Hello, everyone. I am Gabriela Zavala, a Peruvian medical student from Universidad Peruana Cayetano Heredia. I am glad to be here with you today. On behalf of our research team, I'm here to discuss our project, Morbidity and Mortality Conferences, a key step towards quality improvement programs in Peru. Before we start, I would like to introduce the rest of the team. I want to thank Doctors Willie Newman, Eduardo Guaman, Manuel Rodriguez, Charles Mock, and Lacey Legrone. So here's today's agenda. Here are a few facts that I would like to lay out in order to highlight the importance of trauma. According to WHO statistics, emergency surgical diseases account for 15,000 lives lost every day, and every 5 seconds someone in the world dies due to traumatic injuries. Between 34 and 38% of all injury deaths in low middle income countries could be prevented if care initiatives could be implemented through increased investment in trauma care. According to several studies, trauma quality improvement programs have been shown to deliver better outcomes and decrease costs across resource settings. Identify effective and cost effective interventions will decrease the burden of death and disability due to a lack of access to quality surgical care. M&M Conference has long been known as the golden hour of the surgical working week. We cannot expect any change or improvement in our work if we do not dedicate some time to review poor outcomes. We need to take corrective measures. Therefore, next time we will be better for ourselves and for our patients. So, according to WHO's guidelines, the main goals of M&M Conference are 1. Discuss and analyze deaths and complications with the primary objective of learning from suboptimal outcomes. 2. Identify potential areas of improvement. 3. Develop a corrective strategy to optimize care in the future. And finally, ensure a follow up plan to evaluate the effectiveness of the proposed corrective strategy. In 2016, my mentors undertook projects to assess the status of M&M Conference in the Andean region. First one, a mixed method study about TQIP in Peru, and a second one, a comparative study which included countries such as Peru, Bolivia, Ecuador, and Colombia. The last study about M&M Conference in the Andean region performed a multivariable analysis to identify factors predictive of an effective M&M conference. These were the presence of a standardized case selection criteria, note-taking during M&M conference, and a follow-up plan to the M&M conference. For this 2019 study, we repeated the same survey used in 2016. The primary purpose was to do a follow-up of M&M conference in Peru and look for any changes after 3 years, considering that there were no active efforts of diffusion. The subject population was the same and consisted of surgeons, residents, and medical students. We tested for significance using chi-square. So now, let's check the results. As we can see, there was no significant difference over the years. When participants were asked, do M&M conferences occur in your institution, 96% in 2016 said they did occur in comparison to a 91.8% in 2019. People who answered I don't know or left the question blank were treated as missing and were not considered for the statistical analysis. This was applied for all the following questions as well. When they were asked about the frequency of these meetings, the answers follow a similar trend in 2016 and 2019. Most answered weekly and monthly. However, both questions had a p-value over 0.05. When they were asked about the case selection, especially the use of standardized criteria, which was identified as a predictive factor of an effective M&M conference, despite more people in 2019 answered that they used standardized criteria at their institution, the 7.4% difference was not enough to reach statistical significance. The same situation happened when we asked what the perceived objective of M&M conference was. In both 2016 and 2019, improving the system and deciding on the next steps in the patient's treatment were the most voted options. The number of participants varies in this case because this reflects only attendings' responses. However, this will likely change since we are running a validation model of the previous study and combining both data of 2016 and 2019. As expected, note-taking, another predictive factor of an effective M&M, remain unchanged. Despite more participants said yes in 2019, the difference did not meet the statistical significance. Finally, the last predictive factor, a follow up plan, showed the same trend over the years. In the previous 2016 study, showed earlier in this presentation, the options discussed in our conference or chief's decisions were considered a follow up plan. Even though in 2019 Moore answered that the information gathered from the meeting was stored or nothing was done about it, it did not reach statistical significance. So again, we can see similar patterns. Interesting findings are shown here when we combine data from 2016 and 2019. We compared two groups, participants who said no change happened at their institution as a result of M&M conference versus participants who stated yes, a change happened after M&M conference. When perceived obstacles stratified by change as a result of M&M conference were analyzed, we found that participants who perceived lack of interest in M&M conference as the main obstacles may not see a change in their institution. So here are our project's conclusions. Given the strong evidence base for these interventions and the identified areas for optimization of outcomes in Peruvian trauma patients, similar practice patterns and areas of improvement were found. The numbers remain stable over time. We must recognize injury as a major public health problem. It is the leading cause of death in Peruvians among 15 and 29 years old, affecting younger and more productive members of society. We recommend increased national level prioritization of high quality M&M conference in Peru as part of the surgical training, national mandates, and academic interventions, which are essential to address the identified deficiencies. These were the references used in this presentation and in our project. Thank you very much.